Hello, everyone. My name is Akhil Narang. This is the ASE Board Review Lecture, Formulas That You Need to Know, Part 2. In the first part, we talked about physics and hemodynamics. This is the second part of that lecture. This is talking about valve and congenital heart disease. As with the previous lecture, I will be presenting formulas that you need to know in a case format. So we have 12 different questions that we'll be going through today with explanations for each question, each of which has key formulas that you need to know. As we discussed previously, this is a good list of formulas to start out with, but there are many more formulas for the board that you need to know that perhaps may not be covered here. So please make sure that you pay attention to the rest of the lectures in this board review course and annotate all the formulas that are discussed in the previous lectures. As we talked about this previously, but the general topics of the formulas that you need to know include physics and hemodynamics, including intracardiac pressures. That was the focus of the first lecture. And in this particular lecture, we'll talk a little bit more about valvular heart disease quantification, particularly stenosis, regurgitation, and congenital heart disease. As always, I'd like to review some exam tips for you. It's really important to understand and don't memorize the formulas. Understand what the question is being asked as opposed to just memorizing the formula. Remember to avoid distractions in the question stem. Again, distractions might be additional pieces of information that you may not need to know, but are not necessarily relevant to solving the question. Make sure you pay attention to units, as this can often mess people up when it comes to the exam. Often the units for the answer choices may be slightly different from those presented at the answer stem. And as always, it's not enough just to know the formula, but you have to do the math correctly. So I suggest that you write out each question and each formula, even for the easy ones that you think you know right off the bat. And make sure to double check your math. Did you divide by 2? Did you multiply by pi? Did you square the correct term? Some of the answer choices will have answers that will assume that the math was done incorrectly. And of course, these will be the incorrect answer choices. And again, at the beginning of the first section, I always recommend that you take a couple minutes just to write down key formulas like continuity equation, Bernoulli equation, things that are heavily used in the exam and that you don't want to be scrambling to come up with later as you start your test. So let's jump into the questions. So question number 1, a 72-year-old male with aortic regurgitation and progressive symptoms is referred for a transthoracic echocardiogram. Calculate the regurgitant fraction. Assume an LVOT of 2.4 centimeters and a mitral valve annular diameter of 3.0 centimeters. The answer choices are A, 26%, B, 42%, C, 58%, or D, 71%. Because these are recorded lectures, I encourage you to pause after each question to do the math and then look at the answer choices and continue with the lecture. The correct answer in this case is C, 58%. Here is the explanation. In order to determine the regurgitant volume, all we have to know is the LVOT stroke volume and subtract this from the mitral valve stroke volume. The stroke volume from the LVOT is the LVOT area multiplied by the LVOT VTI, and the mitral valve stroke volume is determined by the mitral valve area times the mitral valve VTI. All of these pieces of information are given to us in the answer stem. So regurgitant volume, again, is pi times radius squared for the LVOT stroke volume. And please remember that the diameter given has to be divided by 2 in order to get the radius. And for the mitral valve, the similar thing, pi r squared, where 1.5 is the radius and 3, which was given in the question stem, is the annular diameter. Solving this equation, you get 154 milliliters minus 64 milliliters. This gives us a regurgitant volume of 90 mLs. In order to calculate the regurgitant fraction, we have to divide 90 cc's by 154, and this gives us the correct answer of 54%. The right picture is a schematic of how this is represented. So this is an easy way from echocardiography to determine the regurgitant fraction and regurgitant volume for patients with significant aortic regurgitation using simpler Doppler formulas that you should be familiar with. Question number 2. Was the aortic valve area and dimensionless index for the given scenario? A, aortic valve area 0.16 centimeters squared, dimensionless index or DI 0.19. B, AVA 0.19 centimeters squared, DI 0.16. C, AVA 0.6 centimeters squared, DI 0.19. Or answer choice D, AVA 0.3 centimeters squared, and DI 0.16. The correct answer choice is C, AVA 0.6 centimeters squared, and DI 0.19. Now let's go through this in detail. We are provided on the right side of the picture, right side of the question, with 3 images. The lower image is the LVOT diameter. The left image is the LVOT pulse wave Doppler signal. And the right image is the aortic valve continuous wave Doppler signal with the key values given here, the VTIs noted for each of these. This question needs to be solved using the continuity equation. This is a principle where the area times the flow on one side is equal to the area times the flow on the opposite side, on the other side. So the LVOT, A1 times V1 equals A2 times V2 for the aortic valve. This is a principle that's being used throughout echocardiography, and you should be very familiar with this. Solving for this, we get the LVOT VTI, which is the area, times the LVOT area, I apologize, times the LVOT VTI should equal the aortic valve area, which is what we're going to solve for, times the aortic valve VTI. Solving for this gives us, again, pi times the radius squared. Remember, we're given the diameter in the answer choice. We have to divide this by 2 times the LVOT VTI, which was given in the previous slide, 24, equals what we're solving for, the aortic valve area times the aortic valve VTI, which is 124. This is again derived from continuous wave Doppler. From here, we get an aortic valve area of 0.6 centimeters squared. This is, of course, consistent with severe aortic stenosis. The dimensionless index is simply the ratio of the LVOT VTI divided by the aortic valve VTI. And in this case, we get 24 divided by 124, which is 0.19. Again, this is consistent with severe aortic stenosis. Please be really familiar with this equation to solve aortic valve. Also for using continuity equation for disease and lesions as well, some of which we'll discuss in later questions. Question number 3. Calculate the effective regurgitant orifice area and regurgitant volume for this patient with mitral regurgitation. And here we're shown 2 signals, one a color image zoomed in of the mitral valve with the piezo radius, and then we're shown a continuous wave Doppler signal of the mitral regurgitation. Answer choice A is EROA 0.22 centimeters squared, regurgitant volume R-vol 35 milliliters. Choice B, EROA 0.44 centimeters squared, R-vol 71 milliliters. Answer choice C, EROA 1.41 centimeters squared, R-vol 35 milliliters. And answer choice D, EROA 0.22 centimeters squared, R-vol 71 milliliters. The correct choice is B, EROA 0.44 centimeters squared and R-vol 71. So let's go through this in detail. In order to determine the severity of mitral regurgitation, we often use the flow convergence method, which is also known as the PISA method. In order to first calculate this, we calculate the VFR. And this can be determined by 2 pi r squared times the eliciting velocity, which is noted as VR. If we look at the previous equation, we're given the previous question stem, we're given all of these choices, where 2 times pi, which is 2 times 3.14, the radius squared, which is 0.97, times the eliciting velocity which has been shifted from the Nyquist limit, which is 38.5. This gives us a VFR of 228 milliliters per second. From here, we're able to calculate the EROA. This is the VFR divided by the velocity max of the mitral regurgitation. 228 divided by 5.5 gives us 44 millimeters squared, which is 0.44 centimeters squared. From here, we can calculate the regurgitant volume. The regurgitant volume is simply the EROA times the VTI of the continuous wave mitral regurgitation signal. This comes out to be 0.44 times 161, which gives us a value of 71 cc's. This was the correct answer for this then. Very important that you understand how to use the flow convergence method or the PISA method, not only to understand the amount or severity of regurgitation lesions. This can be done with mitral valve, the tricuspid valve, even the aortic valve, but it also can be used, the PISA method can be used to calculate the area of certain valves as well. Question number 4, please calculate the mitral valve regurgitant volume in milliliters from the following information. Mitral valve annular diameter 4 centimeters, MVVTI 10 centimeters, LVOT diameter 2 centimeters, and LVOT VTI 25 centimeters. Answer choice A, 47 milliliters. Answer choice B, 205 milliliters. Answer choice C, 16 milliliters. And answer choice D, 71 milliliters. Sometimes in questions, you'll be given information that's simply in a text format without pictures, and you'll be expected to solve the problem, as in this case. Correct answer is A, 47 milliliters. Here, we can use the continuity equation to be able to determine the amount of mitral regurgitation. This formula can be used in the absence of patients with significant aortic regurgitation. The formula simply is the regurgitant volume equals the mitral valve stroke volume, subtract minus the LVOT stroke volume. The mitral valve stroke volume, of course, we know is the mitral valve area times the mitral valve VTI, and the LVOT stroke volume is the LVOT area times the LVOT VTI. To solve for this, putting in the numbers from the stem of the question, we get the mitral valve area is 3.14 times radius, again, 4 divided by 2, which is the radius, 2 squared times the MV/VTI, time, which is 10. And the LVOT stroke volume we calculate as pi r squared again, 3.14. The radius is 1 squared times 25, which is the LVOT/VTI. And then we get an answer choice of 126 minus 79, which equals 47 milliliters. Question choice number 5. Calculate the mitral valve area based on the Doppler tracing. A, 0.3 centimeters squared, B, 0.6 centimeters squared, C, 1.2 centimeters squared, or D, 1.4 centimeters squared. Here we're given a Doppler signal of the mitral valve with a deceleration time. And the correct answer is 1.2 centimeters squared. How do we calculate this? In order to do this, we need to know what the mitral valve area is. The equation for the mitral valve area using pressure half time is 220 divided by the pressure half time gives us the mitral valve area. But first we need to calculate the pressure half time for the deceleration time. In order to do this, the formula is 0.29 times the deceleration time equals the pressure half time in milliseconds. So 0.29 times 650, which was given to us in the answer stem, gives us 189. And accordingly, the mitral valve area is 220 divided by 189. This gives us 1.16 centimeters squared, or approximately 1.2 centimeters squared, which is the correct answer. Question number 6. A 60-year-old female with a history of mitral stenosis is evaluated with an echocardiogram. Calculate the mitral valve area. And here we're given 2 images. One, we're given a Doppler image that shows us a radius of flow convergence and an angle, alpha. And on the second image, we're given a Doppler signal for mitral valve with the Vmax velocity. Answer choices are A, 1.45 centimeters squared. Answer choice B, 0.93 centimeters squared. Answer choice C, 2.67 centimeters squared. Or answer choice D, 0.73 centimeters squared. And the correct answer is A, 1.45 centimeters squared. Now, in order to determine the mitral valve area, we use the PISA method for this. The equation for this is shown in the bottom right here. The most important thing to remember for this is you have to take into account the angle or the alpha between the 2 mitral valve leaflets on the atrial side. This was given as 90 degrees in the stem of the question. And other than that, you simply put in the respective values here, 2 times pi, which is 6.28, as shown on the right side image here, times r squared, 1.56 squared, times the ASE velocity, which is given to us as 33. And you divide this by the Vmax of the mitral stenosis, which again is given in the stem of the question of 189. And then we multiply this by 98 over 180, which again accounts for the angle. From here, we get an answer of 1.45 centimeters squared. So very important for you to be able to use the PISA method, not only for regurgitation, but also for calculating the area. Question choice 7. A 25-year-old male with congenital pulmonic stenosis presents with evaluation. What is the severity of his pulmonic stenosis? Mild, B, moderate, C, severe, or D, critical. And here we're given a continuous wave Doppler signal across the pulmonic valve with respective values shown here. And the correct answer is B, moderate. How do we calculate this? Well, for pulmonic stenosis, we want to understand what the peak gradient is. So this is simply 4 times V squared, which is the simplified Bernoulli equation. So 4 times 3.2 squared, which is given to us in the stem of the question, gives us an answer of 41 millimeters of mercury. And below is a table of the severity of pulmonic stenosis according to the peak velocity and peak gradient. The difference with this is we're using peak gradient for pulmonic stenosis as opposed to mean gradient for aortic stenosis. So make sure you pay attention to this. Sometimes you might be just given the peak gradient and have to assign a category of severity based on this. Question choice 8, question number 8. An 81-year-old female with a prosthetic aortic valve is referred for an echocardiogram. Which of the following best describes her prosthetic valve function? Here we're given 2 signals, an LVOT pulse wave signal and a continuous wave signal across the prosthetic valve with a few annotated measurements here. Answer choice A, normal prosthetic valve function. Answer choice B, patient prosthesis mismatch. Answer choice C, prosthetic valve stenosis. Answer choice D, prosthetic valvular regurgitation. So this answer choice, the correct answer choice is C. Understanding how to answer this question not only requires us to be able to calculate certain things, but also understand a flow chart, which is helpful for prosthetic valves. The flow chart is shown on the right here. The first thing we want to be able to understand is what's the Doppler velocity index for this particular patient. And calculating this, we first look at the LVOT velocity and we divide this by the prosthetic valve velocity. And this gives us an answer of 1 divided by 5.5, and the answer is 0.18. So this is the first step in deciding what the Doppler velocity index is. Since we have a number that's low, 0.18, we go to the right side of the flow chart here. The next thing we want to look at is the acceleration time. In this particular situation, we were given an acceleration time that's over 100 milliseconds. So if we follow the algorithm, we have a DVI of less than 0.25. We have an acceleration time of greater than 100 milliseconds. And this gives us an answer that suggests prosthetic valve aortic valve stenosis. So this is how we arrive at this answer. Very important to understand this flow chart and the cutoffs for DVI and for acceleration time when evaluating patients with prosthetic valves. Question number 9. A 72-year-old male with a history of prosthetic mitral valve presents for an echocardiogram. Which of the following best characterizes the prosthetic mitral valve function? So we're given two Doppler images here. Answer choices are A, normal prosthetic valve, B, prosthetic valve stenosis, C, prosthetic valve regurgitation, or D, patient prosthesis mismatch. And this is now for the mitral valve. The correct answer is B, prosthetic valve stenosis. So how do we derive this? Well, we first look at the Doppler ratio for the mitral valve. This is for prosthetic valve dysfunction. In order to do this, look at the VTI, the VTI of the prosthetic mitral valve divided by the VTI of the LVOT. An abnormal number is considered greater than 2.2. In this particular situation, if we use the information given, we get a value that's greater than 2.2. And then we also are given a pressure half time, which is the cutoff for normal, and abnormal is 130 milliseconds. So if we look at the answer choices and the provided question information, we also have a peak velocity, E velocity, which is high. We have a velocity rate, a VTI ratio of greater than 2.2, and we have a pressure half time of greater than 130 milliseconds. This gives us to this category here, where the vast majority of cases are stenosis or obstruction of the mitral valve prosthesis. Question number 10. A 22-year-old female with a secundum ASD is referred for an echocardiogram. What is the QP/QS from the given values? We're given a table of values here on the right side: PA pressure, LA pressure, RA pressure, RVOT diameter and VTI, LVOT diameter and VTI, blood pressure and heart rate. Answer choices are A, 0.42, B, 1.37, C, 2.35, or D, 2.76. And the correct choice is 2.76. This is derived by, the answer is derived by understanding how to calculate QP/QS for a patient with an ASD. For an ASD, the QP/QS is defined by the stroke volume of the RV divided by the stroke volume of the LV. Stroke volume of the RV is simply the area of the RVOT multiplied by the VTI of the RVOT. This is divided by the stroke volume of the LV, which is defined as the area of the LVOT multiplied by the VTI of the LVOT. Putting in the numbers in the table, we get 3.14 times R squared, 1.25 squared times the VTI 30 divided by 3.14 times 1 squared. Again, this is the radius over 20. This gives us an answer, a QP/QS of 2.76. One very important caveat to understand, this is a question that's asked about an ASD. However, if you have a question asking about a PDA, a patent ductus arteriosus, the flow across the LVOT is considered the QP, and the flow across the PDA or the RVOT is considered the QS. So make sure you don't flip those around for answering questions that are asking about PDA. Question number 11. Calculate the pulmonary artery pressure, the PASP, and the PA diastolic pressure from this Doppler tracing of a patient with patent ductus arteriosus. Assume systemic blood pressure is 165 over 65 millimeters per mercury. Here we're showing a Doppler signal that gives us a peak systolic velocity and an end diastolic velocity. Answer choice A, 21 over 7 millimeters of mercury. Answer choice B, 42 over 14 millimeters of mercury. Answer choice C, 36 over 14 millimeters of mercury. And the correct answer is A, 21 over 7 millimeters of mercury. So this Doppler shows us a PDA with a left to right shunt from the aorta to the PA. In order to determine the PA systolic pressure and PA diastolic pressure, we first have to calculate the peak systolic gradient and the end diastolic gradient. The peak systolic gradient, again using the simplified Bernoulli equation, is 4 times the peak systolic velocity squared. This gives us an answer of 144 millimeters of mercury. The end diastolic gradient is then again used to determine the PA diastolic pressure. And we utilize the simplified Bernoulli equation to calculate the end diastolic gradient. For end diastolic velocity squared gives us an answer of 58 millimeters of mercury. In order to determine the PASP, we simply subtract the peak systolic gradient from the systolic blood pressure. This gives us 165 over 100 minus 144, 21 millimeters of mercury. And similarly, in order to determine the PA diastolic pressure, we subtract the end diastolic gradient from the diastolic blood pressure. And this gives an answer of 7 millimeters of mercury. So the correct answer, of course, is 21 over 7. And question number 12. What is the instantaneous peak pressure gradient across the coarctation of aorta, given the following information? Peak velocity of the descending aorta is 3.3 millimeters per second, and the peak velocity in the proximal aorta is 2.3 meters per second. Answer choice is A, 6.1 millimeters of mercury, B, 4.4 millimeters of mercury, or C, 1.0 millimeters of mercury. The correct answer choice is A, 6.1 millimeters of mercury. In order to solve this, we don't use the simplified Bernoulli equation, but in fact, we use the modified Bernoulli equation. So the instantaneous pressure gradient, or delta P, equals 4 times V2 squared minus V1 squared. Generally, we ignore the V1 component of this modified Bernoulli equation so that we just get 4V squared. However, when the velocity of V1 is greater than 1.5, or sometimes people will use a cutoff of 2 meters per second, we must include it, otherwise we can overestimate the true gradients. In this case, since we have high velocities on both sides, we need to take this into account. So the delta P equals 4 times 3.3 squared minus 2.2 squared, which gives us an answer of 6.1 millimeters of mercury. And with that, this concludes the lecture series for the formulas that you need to know, part 1 and part 2. There are many formulas that we've talked about in about 30-odd cases over those 2 lectures. I encourage you to write all the formulas down to make sure you understand them. And of course, these are complementary to what is being used in the rest of the lectures that you've seen today. Thank you and good luck.